The diuretics, the one that we're going to talk about is the osmotic diuretics. The osmotic diuretics include mannitol, urea, organic acids, and glucose, but the most commonly used one is mannitol, and it's only available in IV. The mechanism of action: mannitol is non-absorbable, so it increases osmotic pressure. This in turn draws fluid from around the cells into the tubules, which decrease cellular edema and increase urine production. It shouldn't be used in peripheral edema, however, because it doesn't excrete enough sodium. That's why there's only one sodium in there, so you can see that not enough is being excreted by the tubules. It's also a vasodilator. It increases glomerular filtration and renal plasma flow. This makes it excellent for preventing kidney damage during acute renal failure. The indications for this drug is that it can be used in the early oliguric phase of acute renal failure. It can be used to reduce intracranial pressure, for cerebral edema, to excrete toxins, and as an irrigant to flush the GU in preparation for transurethral surgical procedures.
Some adverse effects for mannitol are some significant ones are convulsions, thrombophlebitis, pulmonary congestion, and some less significant adverse effects would be headache, chest pain, tachycardia, blurred vision, chills, and fever. Contraindications: should not be used in active intracranial bleeding, pulmonary edema, severe renal disease, and in drug allergies. Treatment is terminated if renal or cardiac impairment develops. Administration is IV through a filter, available in 5, 10, 15, 20, and 25%. Mannitol may crystallize when exposed to low temperatures, and this more likely occurs in concentrations greater than 15%. And to avoid crystallization, mannitol is kept in warmers. And remember, before administering mannitol, visually inspect the mannitol container for precipitants.
The way the osmotic diuretics differ from the rest of the diuretics is that they can be used in the early oliguric phase of acute renal failure, and they don't block any receptors like the potassium-sparing diuretics do. Those also work in the distal convoluted tubules, where the osmotic diuretics work in the proximal tube and the descending limb of the loop of Henle's.